You know that moment when you glance at your cat and something just looks off with their eye? I
Yeah.
mean, it's a little red, bit watery, or they're squinting.
Yeah.
Today on the deep dive, we're laser focused on that very scenario, conjunctivitis in cats.
Exactly. And it's really common. We've sifted through a comprehensive veterinary guide, basically, to bring you the need to know information about this feline ailment.
Right.
Our goal is to give you a clear understanding of what it is, what triggers it, and, well, what it means for your cat's well-being, so you can feel informed and know when it's maybe time to seek help.
Okay, so let's get right to it. What is conjunctivitis in cats? What are we actually talking about here?
Simply put, it's an inflammation of the conjunctiva.
Okay.
Think of that delicate pink tissue you see when you gently pull down your cat's lower eyelid or look at the white part of their eye.
Mm-hmm.
That membrane covers the front of the eyeball, what's technically called the anterior sclera, and it lines the inside of the eyelids, including that little third eyelid they have.
Ah, the third eyelid, yeah.
And what's key to understand is that this tissue has a really rich blood supply,
Okay.
which is why it can get so red when it's inflamed. Makes sense, right?
Yeah, totally. So it's not always the main problem then. It could be like a sign of something else going on.
Precisely. Conjunctivitis can be the primary issue, absolutely,
Right.
the main event. But yeah, quite often it pops up as a secondary problem, something triggered by something else affecting the eye or maybe the structures around it.
Got it. So if your cat has conjunctivitis, what's the main body system that's being affected here?
It's primarily an issue within the ophthalmic system, basically, the eyes themselves and, like we mentioned, those protective eyelids.
How common is this? I mean, is it something most cat owners will likely deal with at some point?
Unfortunately, yes. Conjunctivitis is a very, very common condition we see in our feline companions. You're definitely not alone if your cat experiences it.
Hmm. Are some cats more prone to it than others?
Well, interestingly, the information suggests that certain purebred cats might have a slightly higher tendency towards the infectious types of conjunctivitis.
Okay. Purebreds.
And also keep an eye out with younger animals. Kittens and young cats are pretty frequently affected by the infectious forms.
Right. So what are the red flags for us cat owners? What are the telltale signs that should make us think, maybe it's conjunctivitis?
Okay, there's several key things to watch for. One of the first signs you might notice is blepharospasm.
Blepharospasm.
Blepharospasm is just the medical term for squinting or, excessive blinking.
Oh, okay, squinting. Got it.
You might also see what's called conjunctival hyperemia, which is simply redness of that pink tissue around their eye.
Just looks red and sore.
Exactly. Ocular discharge is another very common sign. Now, this discharge can vary quite a bit. It could be watery and clear, like tears, we call that serous discharge.
Mm-hmm.
Or it might be thicker and mucus-like, which is mucoid. Yeah, kind of goopy, or even a combination of mucus and pus, which we describe as mucopurulent. So like yellowish or greenish discharge.
Oh, that doesn't sound comfortable for them at all. Are there any other visual clues we should be aware of?
Absolutely. Another sign is chemosis.
Chemosis.
Chemosis, yeah. You might notice it as a sort of puffy or swollen appearance of the usually clear tissue around your cat's eyeball. It looks kind of bubbly or gelatinous sometimes.
Oh, wow. Okay.
In some cases, you might also see small bumps on the conjunctiva called conjunctival follicles. And here's a connection to keep in mind. If the conjunctivitis is caused by an infection, it's often linked to signs of an upper respiratory infection.
Ah, so like sneezing or a runny nose too.
Exactly. Sneezing, runny nose, maybe some lethargy, that whole package deal sometimes.
Okay, so it can show up in a few different ways. What's actually causing conjunctivitis in cats? You mentioned infections, but is it always an infection?
Not at all, no. There's a whole spectrum of potential causes, and we generally group them into different categories. Let's start with the infectious causes, specifically viruses.
Viruses, okay. Which are the main ones we should know about?
The most common viral culprit by a significant margin is feline herpesvirus, often just called FHV.
FHV, right.
And this is where it gets really interesting for understanding what's going on. FHV is the only cause of conjunctivitis in cats that typically leads to changes on the cornea itself.
On the cornea, the clear part.
Yes, the clear front surface of the eye. These changes can look like tiny branching ulcers called dendritic ulcers. They literally look like little tree branches.
Wow.
Or they can be larger, more irregular ulcers known as geographic ulcers. So if your vet mentions corneal involvement, FHV is a prime suspect, a really big one.
That's a really important distinction to remember. Dendritic ulcers, FHV.
Okay.
Are there other viruses involved?
Yes, feline calicivirus is another one. While FHV tends to affect the cornea, calicivirus is maybe more likely to cause little ulcers, specifically on the conjunctiva itself, that pink tissue.
Okay, different location for the ulcers. Got
Yeah.
it. So those are the viruses. What about bacteria? Can they cause it too?
Absolutely. Several types of bacteria can be involved. One important one is Chlamydia felis.
Oh my God.
Yeah. And a really common sign with this particular bacterial infection is significant chemosis, that noticeable swelling of the conjunctiva we talked about earlier, really puffy. Then we have Mycoplasma SPP, and the interesting thing here is that sometimes it might not be a true infection, but rather an overgrowth of bacteria that are normally present in small numbers on the eye's surface anyway.
Oh, that's fascinating. Like the natural balance just gets thrown off.
Exactly. Something disrupts the normal flora, and the mycoplasma takes advantage. Now, the source mentioned something about newborn kittens, too.
Yeah, what's going on with them?
Yes, that's conjunctivitis neonatorum. Basically, this refers to the accumulation of exudates discharge, essentially under the still closed eyelids of newborn kittens, before their eyes have naturally opened.
Oh, poor little things.
Yeah. This can be caused by either bacteria or viruses that the kitten might have picked up during birth from the mother's birth canal. It's closely related to a term you might hear, ophthalmia neonatorum, which describes a very similar situation. Got to get those eyes open and cleaned out quickly.
Right, makes sense. So it's not just infections then. What else can irritate the eye and cause conjunctivitis?
Exactly right. We also see immune-mediated causes.
Immune system related.
Yep. These include conditions like eosinophilic conjunctivitis, lipogranulomatous conjunctivitis, and just plain allergic reactions, much like how we can get hay fever or allergies that affect our eyes.
Okay. Allergies.
And it's also important to know that conjunctivitis can sometimes be a sign of a more widespread immune-mediated disease affecting the entire body, not just the eye.
And I imagine physical things can cause it too, right?
Right.
Like getting something in their eye.
Definitely. Trauma, for sure. Like a conjunctival foreign body, literally something stuck under the eyelid or on the conjunctiva, like a grass seed or a bit of grit. That can certainly lead to inflammation.
Ouch.
Also, irritation from environmental factors. Think about dust, smoke, chemical cleaners, aerosols, or even sometimes certain eye medications themselves can trigger conjunctivitis if the cat's sensitive.
Huh. Even the treatment could potentially irritate it.
Okay.
The eyes are just so delicate, aren't they?
They really are.
What about problems with the structures around the eye? Can they lead to conjunctivitis?
That's another really important category. Conjunctivitis secondary to what we call adnexal disease issues with the surrounding structures.
Adnexal.
So, for example, if there's scarring around the eye, maybe from a previous injury or infection, it can sometimes lead to keratoconjunctivitis sicca, or KCS. That's dry eye.
Dry eye, right.
And the lack of proper lubrication, the tears, can then irritate the conjunctiva. Makes sense?
Yeah.
Then there are eyelid problems like entropion.
Where the eyelid rolls inward.
Exactly, rolls inward, causing the fur and eyelashes to rub right on the eye. Super irritating. Then there's trichiasis, where eyelashes grow in the wrong direction, rubbing on the eye. Distichia, which are extra eyelashes growing from an abnormal spot on the eyelid margin, again, rubbing. Or even eyelidogenesis, where a part of the eyelid just doesn't form properly, leaving the eye exposed.
Wow. Lots of ways for eyelids to cause trouble.
Absolutely. All of these can cause chronic friction and irritation, leading to conjunctivitis. And even issues with the tear drainage system, like dacryocystitis, that's inflammation of the tear sac or a blockage in the nasolacrimal duct, the tube that drains tears from the eye to the nose, that can contribute too.
Yeah.
If tears aren't draining properly, things can get backed up and inflamed.
Okay, and what if there's already something wrong with the eye itself, like inside the eye or on the surface? Can that cause it?
Yes, absolutely. Conjunctivitis can also be secondary to other ocular diseases. For instance, an ulcerative keratitis, an ulcer on the cornea, will almost always cause some degree of conjunctivitis because the whole eye is inflamed.
Makes sense.
Or a corneal sequestrum, which is a kind of unique condition where a dark, sometimes black piece of dead tissue forms on the cornea in cats, often related to FHV or chronic irritation. That sequestrum acts like a foreign body and definitely triggers inflammation of the conjunctiva.
Okay, we've covered a lot of ground on the causes there. Viral, bacterial, immune, trauma, eyelid issues, other eye diseases. Are there any specific things that might make a cat more likely to get conjunctivitis in general?
Yes, certain risk factors can definitely increase a cat's chances. Stress is a big one.
Stress.
Or anything that weakens their immune system. This can make them more susceptible, particularly to that feline herpesvirus we talked about.
Because it can reactivate.
Exactly. FHV can lie dormant in the nerves, kind of hiding out, and then reactivate during times of stress, like moving house, a new pet, illness, leading to flare-ups of conjunctivitis or respiratory signs.
Okay, stress is a key factor, especially for herpes. So, if a cat owner suspects their cat has conjunctivitis, they take them to the vet. What will the vet actually do to figure out what's going on? What's the diagnosis process look like?
Right. So the first crucial step for the vet is to determine if it's primary conjunctivitis, meaning the conjunctiva itself is the main problem, or if the redness and inflammation are actually a sign of a deeper, potentially more serious problem within the eye.
How do they tell the difference?
Well, a thorough and systematic eye examination is absolutely essential. They need to rule out other conditions that can cause similar signs, like red eyes or squinting. We're talking corneal ulcers, uveitis, which is inflammation inside the eye,
Maybe it's about
coma, which is increased pressure within the eye,
eye pressure, yeah.
or even issues behind the eye in the orbit, like an abscess or a tumor. Those can push the eye forward and make it look red.
So what specifically will the vet be looking at during this exam? What tools do they use?
They'll carefully assess things like the size and symmetry of your cat's pupils. Are they the same size? Are they reacting to light properly? They'll use special instruments like an ophthalmoscope to look inside the eye for any cloudiness or signs of inflammation in the front part, something called aqueous flare, which indicates uveitis.
Aqueous flare.
Yeah, it looks like headlight beams in fog inside the eye. And they'll likely measure the pressure inside the eye, the intraocular pressure or IOP, using a tonometer. That's crucial for ruling out glaucoma.
The pressure test, okay.
And a very important diagnostic tool, as you might guess, is fluorescein staining.
The dye test.
Exactly. It's a harmless orange dye that's applied as a drop to the surface of the eye. Then, under a special blue light, it will stick to and highlight any areas where the top layer of the cornea is damaged. So it shows up ulcers brilliantly, including those characteristic branching dendritic lesions caused by FHV.
So that's key for finding ulcers and FHV signs. I've seen vets do that. What else can the vet learn just from looking closely?
They'll also closely examine the blood vessels in the eye. This is important. If the redness is due to inflammation of the conjunctiva itself, the blood vessels will typically look superficial, bright red, maybe a bit wiggly, and they might move slightly if the vet gently moves the conjunctiva with a cotton swab.
Okay.
However, if they see deeper, darker, more straight or linear, and less mobile blood vessel congestion, that often points towards inflammation or disease inside the eye, like uveitis or scleritis. So differentiating between conjunctival and episcleral vessel congestion helps pinpoint where the problem is.
That's quite subtle.
It takes practice. Also, if the vet notices any kind of mass or unusual growth on the conjunctiva, they might recommend a biopsy. Taking a small sample to send to the lab can help identify if it's something serious like neoplasia cancer. Lymphoma and squamous cell carcinoma are the most common types found there in cats.
Okay, biopsy for masses. What about general health checks like blood tests or urine tests?
Usually, routine blood work and a urinalysis are normal in cases of straightforward conjunctivitis. They wouldn't necessarily show anything specific unless there's suspicion of a more widespread systemic illness that might be contributing.
Right.
However, if an infectious cause is suspected, especially in a cat that's maybe chronically ill or unvaccinated, the vet might recommend blood tests to check for feline leukemia virus, FALV, and feline immunodeficiency virus, FIV.
FALV and FIV, to check the immune system status.
Exactly, because having one of those underlying viruses can definitely compromise the immune system and make the cat more prone to other infections, including severe conjunctivitis.
Okay. Are there any other specific tests they might perform focused directly on the eye or the infection?
Yes, absolutely. A really careful examination of the adnexa, that's the eyelids, third eyelid, tear ducts, all the surrounding tissues, is crucial. They're looking for any abnormalities like those eyelid issues we discussed, or maybe a hidden foreign body tucked under an eyelid.
You got to check everywhere.
Yep. They'll also want to assess whether the tear drainage system, the nasolacrimal duct, is working properly. One way they can do this is by watching to see if that fluorescein sting we talked about earlier eventually appears at the cat's nostrils after a few minutes.
Oh, so the dye should drain through.
Yeah, ideally, yes. It shows the pathway is open from the eye to the nose.
And if it doesn't appear, or if they suspect a blockage,
If the stain doesn't appear, or if there's maybe thick discharge coming from the tear duct opening, or other signs suggesting a blockage or inflammation, dacryocystitis, the vet might perform a nasolacrimal flush or cannulation.
Flushing the tear duct.
Basically, yes, gently flushing a sterile fluid through the little openings of the tear ducts in the corner of the eye to check if it flows through easily to the nose or if there's resistance. Now, if a bacterial infection is suspected as the main cause, the vet might take a sample using a sterile swab for bacterial culture and sensitivity testing.
To find out which bacteria and which antibiotic works.
Precisely. Identify the specific bacteria causing the trouble and determine which antibiotics will be most effective against it. And it's really, really important that this sample is taken before any topical medications, anesthetic drops, or even that fluorescein stain are put in the eye.
Why before?
Because any of those substances could potentially kill off the bacteria or inhibit their growth in the lab, leading to a false negative result or making it hard to grow anything. You want the sample as clean as possible.
That makes total sense. You want an accurate picture. What about measuring tear production? Is that something they might do routinely?
Yes, particularly if the surface of the eye looks dull or if there's thick, stringy mucus or other signs suggesting dryness. In that case, the vet might perform a Schirmer tear test.
Schirmer tear test.
It involves placing a small special paper strip just inside the lower eyelid for about 60 seconds to measure how much tear fluid it absorbs. It gives a quantitative measure of tear production. And again, this test should ideally be done before any other eye drops or treatments are administered, as those can affect the results.
Okay, so culture and tear tests ideally first. Can they look at the cells directly?
Yes, they might collect a sample of cells from the conjunctiva for cytology. This usually involves gently scraping the surface of the conjunctiva with a special spatula or brush, or sometimes just collecting discharge.
And what does looking at the cells tell them?
Looking at those cells under a microscope can provide really valuable clues about the cause. For example, finding a large number of specific white blood cells called eosinophils would strongly suggest eosinophilic conjunctivitis. Seeing certain types of bacteria clinging to the cells, or maybe characteristic inclusion bodies inside the cells, could point to chlamydial or mycoplasmal infection. In some, maybe rarer cases, they might even see changes within the cells suggestive of feline herpesvirus infection, like intranuclear inclusion bodies.
So cytology can give a lot of information pretty quickly. Are there any more involved diagnostic procedures they might use?
In some situations, yeah. Especially with persistent cases that aren't responding to initial treatment, or if things look unusual, the vet might recommend a conjunctival biopsy.
Taking a small piece of the tissue.
Exactly. Taking a small tissue sample for histopathology, a more detailed examination under a microscope by a pathologist. This can be particularly helpful for diagnosing those mass lesions we mentioned, confirming suspected immune-mediated diseases like eosinophilic conjunctivitis, or figuring out what's going on in chronic, stubborn cases.
Okay, and what about testing specifically for viruses or chlamydia?
Yes, there are more advanced molecular tests. PCR testing polymerase chain reaction can be used to specifically detect the DNA of organisms like Chlamydia felis or feline herpesvirus from conjunctival swabs. It's very sensitive.
PCR. Heard about?
Virus isolation, where they try to actually grow the FHV from a sample in the lab, or immunofluorescence assay, IFA testing, which uses antibodies to detect viral proteins on cells, can also be used for FHV diagnosis. However, it's worth noting that a recent fluorescein stain application can sometimes cause a false positive result with IFA testing, so timing matters.
Good to know.
And finally, while blood tests can detect antibodies against FHV, showing the cat has been exposed or vaccinated, these aren't generally very reliable for diagnosing an active infection causing the current conjunctivitis. So many cats have antibodies anyway.
Right, exposure is so common. Wow, okay, it sounds like vets have quite a few tools and tests at their disposal to really figure out the specific cause.
They do. A systematic approach is key.
So once they have a diagnosis, or at least a strong suspicion of the cause, what are the typical treatment approaches for feline conjunctivitis? How do they fix it?
Well, the treatment strategies are very much tailored to the underlying cause. That's why diagnosis is so important. For conjunctivitis caused by just a simple irritant like dust or smoke, sometimes just flushing the eyes thoroughly with a sterile saline solution, and if possible, removing any visible foreign material is enough. Identifying and removing the source of irritation is key there.
Just flush it out.
Pretty much. In most cases of conjunctivitis, there aren't specific restrictions needed on your cat's activity level. They can usually go about their business. However, if feline herpesvirus is the likely cause, Remember the stress connection.
Yeah.
Managing stress in your cat's environment becomes a really important part of the overall management plan to help prevent flare-ups.
How do you do that?
While things like providing hiding places, stable routines, avoiding conflict with other pets, using pheromone diffusers sometimes,
Hmm.
trying to keep their world calm and predictable.
Makes sense. And if it's infectious?
All right. If the conjunctivitis is due to an infectious agent like chlamydia, mycoplasma, or an active FHV flare-up, isolating the affected cat from other susceptible animals in the household is crucial to prevent the infection from spreading, especially in multi-cat homes or catteries.
Isolation. Okay. What about diet? Does that play a role?
In most cases, no. A change in diet isn't typically necessary unless the vet specifically suspects an underlying food allergy might be contributing to, say, allergic conjunctivitis. In that situation, they might recommend a special food elimination trial using a prescription hypoallergenic diet. But for most causes, diet isn't the main focus.
Gotcha. What about actually administering the medications? Eye drops and ointments can be tricky with cats. Do you have any tips for owners?
Oh, absolutely. Client education here is so important for treatment success. If your vet has prescribed both eye drops, which are solutions, and eye ointments, there's a specific order.
Okay.
The general rule is to apply the drops first. Let them sit for about 5 minutes to allow them to absorb properly into the eye tissues. Then, after that wait, you apply the ointment.
Drops before ointment. Wait, 5 minutes. Got it.
Exactly. Ointments are thicker and can coat the eye, preventing drops applied afterwards from getting absorbed properly. Also, it's really essential to gently clean away any discharge or crusts around your cat's eyes with a clean, warm, damp cloth before applying any medication.
Clean the canvas first.
Precisely. You want the medication to reach the eye tissues, not just sit on top of gunk. And always follow your veterinarian's instructions exactly regarding how often to give the medication and for how long. Even if the eye looks better, finish the full course unless your vet tells you otherwise.
Don't stop early.
Definitely not, especially with antibiotics or antivirals. And it's vital to know when to seek a reevaluation. If you don't see any improvement in your cat's eye within, say, a few days, or if it seems to be getting worse, or if you notice any new or concerning signs, or maybe suspect an adverse reaction to the medication, don't hesitate. Call your vet.
Okay, good advice. Are there ever situations where surgery might be necessary to treat conjunctivitis itself or maybe complications from it?
Yes, surgery isn't the first line for most conjunctivitis, but it definitely has a role in certain specific scenarios.
Like what?
Well, for a condition called lipogranulomatous conjunctivitis, where there's specific inflammation and swelling of the meibomian glands in the eyelid, surgical removal or debulking of the affected glandular tissue might be needed. Okay. And if eyelid abnormalities like entropion, that inward rolling, are the root cause of chronic irritation and secondary conjunctivitis, then surgical correction to permanently reposition the eyelid is often the best long-term solution. Sometimes temporary fixes are tried first, but surgery might be needed.
Fixing the underlying eyelid problem.
Exactly. Now, treating a blocked nasolacrimal duct surgically can be challenging, and unfortunately, it's often not fully successful long-term, but different surgical approaches might be considered in persistent cases. Flushing might be repeated first.
Right.
For conjunctival tumors or neoplasia, the treatment really depends on the type and extent of the tumor. It could involve local surgical removal, maybe cryotherapy freezing the tumor, or radiation therapy, sometimes in combination. In more severe cases of aggressive tumors, unfortunately, removal of the entire eye, either enucleation, removing the globe, or exenteration, removing the globe and surrounding tissues, might be the necessary recommendation.
Wow.
If symblepharin, remember those adhesions that can form between the conjunctiva and sometimes the cornea after severe inflammation, often from FHV.
Yeah, the sticking together.
If those develop and cause problems like restricting eye movement or covering the cornea, surgery might be needed to carefully dissect and break them down, but usually only after the active infection or inflammation is well under control.
Makes sense.
And finally, in cases of corneal sequestration, that dark plaque on the cornea, surgical removal of the abnormal corneal tissue, a procedure called a keratectomy, is often the most effective treatment to resolve the pain and inflammation, including the secondary conjunctivitis it causes. Sometimes a graft is placed afterwards.
Okay, so surgery has its place for specific causes or complications. Let's dive a little deeper into specific medications. For some of those main causes we discussed, like herpes, chlamydia, what are the common go-to treatments?
Right. So for conjunctivitis caused by feline herpesvirus, FHV, It's interesting because mild first-time infections, especially in young kittens, might actually resolve on their own without needing specific antiviral treatment. Just supportive care, keeping the eyes clean.
Oh, okay. They can sometimes fight it off.
Sometimes, yes. However, for more severe or persistent cases, or definitely if there's involvement of the cornea keratitis, those ulcers, or if they're planning surgery to remove a corneal sequestrum that's suspected to be related to FHV, then antiviral medications are typically used.
Antivirals for herpes. Which ones?
These medications usually need to be continued for a decent period, often about 2 weeks after all the clinical signs have completely resolved, to try and really knock the virus back down. Examples of topical antiviral eye medications include things like cidofovir, idoxuridine, vidarabine, and tiflurine.
Lots of options.
Yeah, they work by interfering with viral replication. It's worth noting that trifluridine, while effective, can sometimes cause a bit more irritation or stinging to the eye compared to the others.
Good to know. Are there oral options?
Yes. Oral famciclovir is an antiviral medication that has been shown to be quite effective and generally safe for treating systemic signs and eye problems from FHV in cats. The exact dosage can sometimes vary depending on the cat and the severity, so vets often tailor it.
Famciclovir. Okay.
And you might also hear about L-lysine, or just lysine. It's an over-the-counter oral amino acid supplement. It's thought to potentially interfere with herpesvirus replication, and while the evidence is debated a bit, it's often recommended by vets as part of the management plan for FHV, as it's generally very safe.
Lysine. Okay, so topical antivirals, maybe oral famciclovir, maybe lysine for herpes.
Yeah.
What about those bacterial infections like Chlamydia, Felis, and Mycoplasma?
Okay, for infections confirmed or strongly suspected to be caused by Chlamydia felis or Mycoplasma spp, topical antibiotic ointments are the mainstay. Commonly prescribed ones include tetracycline, erythromycin, or chloramphenicol.
Standard antibiotics.
Pretty much. These are typically applied quite frequently, maybe every 6 to 8 hours. And again, treatment needs to be continued for several days, usually a week or two after the eye looks completely normal again, to really clear the infection.
Finish the course.
Absolutely. Unfortunately, recurrence or reinfection is fairly common with these types of bacteria, especially chlamydia. A topical ciprofloxacin solution, which is a different class of antibiotic, a fluoroquinolone, is another option that might be used.
What about oral antibiotics for those?
Yes, in some cases, particularly for Chlamydia felis, which can sometimes have systemic effects or be harder to clear just topically, the veterinarian might prescribe oral doxycycline. It's usually given once daily for maybe 3 to 4 weeks. It can sometimes be more effective or used in combination with topical treatments, especially if there are respiratory signs too.
Doxycycline, I've heard of that one for cats.
Yeah. Ideally, though, the choice of antibiotic, whether topical or oral, should really be guided by the results of that bacterial culture and sensitivity test, if one was performed. That tells you exactly what you're fighting and what drug will kill it.
Right, targeted treatment.
Exactly. Now, for that conjunctivitis in newborn kittens, the neonatal kind,
Yeah.
the priority there is to very gently open the eyelids if they're sealed shut, allow any trapped discharge to drain out, and then start treatment with a broad-spectrum topical antibiotic ointment like tetracycline or erythromycin. If feline herpesvirus is also suspected in the litter or the queen, then a topical antiviral medication might be added as well.
Okay, gentle opening, cleaning, antibiotics, maybe antivirals for the little ones. And what about those immune-mediated types of conjunctivitis, like the eosinophilic kind?
Right, for immune conditions like eosinophilic conjunctivitis, the main goal is to suppress that inappropriate immune reaction. So topical corticosteroids like dexamethasone or prednisolone acetate eye drops or ointment are often very effective initially.
Steroids for inflammation.
Exactly. The dose is usually started higher to get the inflammation under control quickly, and then it's gradually tapered down over weeks or months to find the lowest possible dose that keeps the condition managed without side effects. Sometimes, for long-term management, the vet might switch the cat to a different type of topical immunomodulating medication, like cyclosporine or tacrolimus, which can have fewer long-term steroid side effects.
Yes, fluorescein.
In very, very resistant or severe cases of eosinophilic conjunctivitis, oral magistral acetate, which is a potent progestin with anti-inflammatory effects, might be considered. But honestly, it's generally used as a last resort because it can have some pretty significant systemic side effects like causing diabetes or weight gain. Vets are usually quite cautious with it.
Last resort only. Okay, now you mentioned steroids. Are there any medications that cat owners should absolutely know to avoid, like real danger zones?
Yes. This is a critical point to hammer home. Super important. Topical corticosteroids, steroid eye drops, or ointments should never be used if there's a known or even a suspected infectious cause of the conjunctivitis, especially feline herpesvirus.
Why not?
Because steroids suppress the local immune response in the eye. If you put steroids on an eye with an active herpes infection, you can essentially shut down the cat's ability to fight the virus, leading to a severe, potentially blinding flare-up of the FHV infection. It can make ulcers much, much worse and deeper. Steroids can also increase the risk of a corneal sequestrum forming.
Okay, so NO steroids, if infection, especially herpes, is suspected. Big no-no.
Huge no-no. Also, related to that, topical corticosteroids should never be used if a corneal ulcer is present, regardless of the cause. Steroids significantly delay corneal healing and can cause ulcers to melt or perforate, which is catastrophic. Vets will always stain the eye to check for ulcers before prescribing steroids.
Stain first, steroids maybe later, only if no ulcer.
Absolutely. And one more really important one, famciclovir.
Famciclovir.
Yeah, it's an antiviral medication commonly prescribed for herpes infections in humans. It works great in people, however, it should never be given to cats.
Never. Why?
It causes severe, often fatal toxicity in cats. It can lead to kidney failure and neurological problems. It's metabolized differently in cats. So, famciclovir is absolutely contraindicated. Famciclovir is the safe oral antiviral choice for cats.
Wow. Okay. Famciclovir equals never for cats.
Right.
Got it. That's really crucial information to have. Are there any general precautions to keep in mind when using any eye medications for cats?
Yeah, a couple of things. Sometimes even the right topical medications can cause some mild temporary irritation or redness when they're first applied. A little stinging is possible. If it seems severe or persistent, definitely check with your vet. Also, any cat that is being treated with topical corticosteroids, even for a valid reason like eosinophilic conjunctivitis, needs to be monitored closely by the veterinarian. They'll likely recheck the eye periodically, including restaining, to make sure a corneal ulcer doesn't develop as a side effect or because of an underlying issue. If an ulcer is detected while on steroids, the steroid medication must be stopped immediately.
Constant vigilance with steroids. Okay.
Yeah.
What happens after the treatment starts? How often should a cat with conjunctivitis typically be rechecked by the vet?
Good question. Typically, your veterinarian will want to re-examine your cat relatively soon after starting treatment, often within about 5 days or so. This is to assess how well they're responding to the chosen therapy. Is it getting better, staying the same, getting worse?
First check-in within a week.
Usually, yeah. Depending on the underlying cause, the severity, and how well the cat is responding to treatment, they might then schedule another follow-up appointment in maybe 2 weeks, or perhaps sooner or later as needed based on progress. Chronic conditions like FHV or immune disease might need longer-term monitoring.
Okay. And what about preventing conjunctivitis from happening in the first place or coming back? Are there any general strategies cat owners can employ?
Prevention really focuses heavily on managing any underlying health issues that might make your cat more susceptible. And like we talked about, for cats with a known history of feline herpesvirus, minimizing stress in their environment is absolutely key.
Reduce the stress triggers.
Exactly. Providing plenty of environmental enrichment things to do, places to climb, predictable routines, safe hiding spots, avoiding overcrowding or conflict with other pets, all of that can really help reduce stress and potentially decrease the frequency or severity of FHV flare-ups.
Good environment, less stress, maybe less herpes.
That's the idea. And as mentioned before, if you have a cat that has been diagnosed with an active infectious form of conjunctivitis, like chlamydia or calicivirus, it's really important to isolate them from any other cats in the household, especially kittens or immune-compromised cats, to prevent the spread of the infection until they're clear. Preventing re-exposure to known infectious sources is also important if possible.
Isolate the sick ones. Okay, what about vaccination? Does that help prevent conjunctivitis?
Vaccination plays a role, yes. The standard core vaccines for cats typically include protection against feline herpesvirus and feline calicivirus, which are major causes of conjunctivitis and upper respiratory infections. Vaccination is definitely recommended as part of routine kitten and adult cat preventive care.
So vaccines help?
They help, but it's important to understand that these vaccines may not completely prevent infection altogether, especially if the cat was exposed to the virus before being fully vaccinated, like a kitten getting FHV from its mother very early on. However, vaccination can significantly reduce the severity and duration of clinical signs if the cat does get infected or have a flare-up, so it lessens the impact.
Reduces severity, doesn't always prevent infection.
Got it.
Are there any potential complications that can arise from conjunctivitis if it's, say, not treated properly or if it's a particularly nasty case?
Yes, unfortunately, several complications can occur, especially with chronic or severe inflammation. Corneal sequestration, that dark spot on the cornea we keep mentioning, often linked to chronic FHV infection or irritation, is one significant potential complication.
The sequestrum.
Symblepharon, the formation of those adhesions or scar tissue between the conjunctival surfaces or even between the conjunctiva and the cornea, can also develop after a really severe inflammatory episode, again, often FHV related. These adhesions can sometimes impair vision or eyelid movement.
Scarring and sticking.
Exactly. And in some cases, particularly with chronic recurrent feline herpesvirus infection damaging the conjunctiva and potentially the tear glands over time, keratoconjunctivitis sicca, or dry eye, KCS, can develop as a secondary long-term issue. The chronic inflammation messes with tear production or distribution.
So, sequestra, symblepharon, dry eye,
Yeah.
potential long-term issues. What's the typical outcome for a cat with conjunctivitis? What's the overall prognosis generally look like?
It really varies depending on the cause. For cats infected with feline herpesvirus, it's important for owners to understand that most of them will become lifelong carriers of the virus. It doesn't just go away completely.
Lifelong carriers.
Yes. While they may experience fewer or less severe episodes of conjunctivitis or respiratory signs as they get older and their immune system matures, periods of stress can certainly trigger flare-ups throughout their lives. So it's often about management rather than cure for FHV.
Manage the flare-ups.
Right. Bacterial conjunctivitis, on the other hand, generally has a good prognosis and usually resolves completely with appropriate, timely antibiotic treatment, provided the right antibiotic is used for long enough.
Bacterial usually curable.
Usually, yes. For those immune-mediated conditions like eosinophilic conjunctivitis, the goal is often long-term control of the inflammation rather than achieving a complete cure. It often requires ongoing, sometimes lifelong, low-dose medication like topical steroids or cyclosporine to manage the condition and prevent relapses.
Immune ones need long-term management.
Often, yes. And finally, if the conjunctivitis is secondary to another underlying problem like dry eye, entropion, or a corneal sequestrum, the prognosis for resolving the conjunctivitis really depends entirely on how successfully that primary underlying condition can be treated or managed. Fix the root cause, fix the conjunctivitis.
Address the underlying issue. Makes perfect sense. So to kind of bring it all together, what's the most important thing for us listening to remember from this whole deep dive into feline conjunctivitis?
I think the crucial takeaway is that conjunctivitis in cats is, yes, a very common condition, but, and this is the important part, it can have a really wide variety of underlying causes. It's not just one thing.
Lots of different reasons for red eyes.
Exactly. And because of this diversity of causes, it's absolutely essential to get an accurate diagnosis from your veterinarian. They have the tools and knowledge to figure out why the eye is inflamed. This ensures that your cat receives the most appropriate and effective treatment targeted at the specific cause. Just trying to treat it yourself at home without knowing the cause, maybe with leftover medication, could potentially make things worse, especially if you used steroids on an infection, or at the very least, delay proper effective care.
Don't guess. Get a diagnosis. That's really valuable information and a good reminder for all of us cat owners to pay close attention to our feline companions' eyes. They can't always tell us what's wrong.
Absolutely. Regular observation of your cat's eyes, just making it part of your daily interaction and seeking prompt veterinary attention if you notice any signs of inflammation, redness, squinting, discharge, swelling, anything unusual, are really key. Early intervention can often lead to a quicker resolution, less discomfort for your cat, and help prevent those potential complications we discussed.
Catch it early. That's excellent advice. And on that note, here's maybe a final thought for you, the listener, to consider. Given just how widespread feline herpesvirus is in the cat population, I mean, a huge percentage of cats are carriers. And given how significantly stress can contribute to those frustrating eye flare-ups, how much of a difference could really focusing on creating a calm, predictable, and enriched environment actually make in supporting the long-term eye health and, frankly, the overall well-being of our feline friends?
That's a great point. The environment-stress-health connection is huge for cats.
It's definitely something worth pondering and perhaps discussing further with your own veterinarian next time you're in. Thanks so much for joining us for this deep dive.
My pleasure. Always good to talk cats.